it with Streptococcus. Remember, Staphylococcus and Streptococcus are different genera. Those names have to do with arrangement of cells. Strepto is chains, Staphylo is grape-like clusters, Staphylo are grape-like clusters. Anyway, Staphylococcus aureus, Escherichia coli, and yes, I'll let you get away with calling them E. coli. I will not let you get away with calling Staphylococcus aureus S. aureus. Too many S's. There's also other E's like Enterobacter and Erwinia and so forth. But anyway, and Pseudomonas aeruginosa. So again, these three you need to be able to write out genus name, species, specific epithets. They won't be on the map. As we go through these, I'll specifically tell you which ones are on the matching, and then I can tell you a little more about these important ones, so that you know what kinds of things will give you a hint what goes in the blank. So we're starting out with infections or diseases associated with the integumentary system, the skin, sometimes layers beneath the skin as well. So Staphylococcus aureus, again, this is not a match, but this is an organism that you really need to know the name of. They are gram-positive. We started working with these right at the beginning of the semester. Remember mix A plates? We had Staphylococcus aureus on those plates. They formed circular colonies that were entire, low convex, smooth, shiny, white, quite opaque. Anyway, they are pyogenic. Again, pyogenic means pus forming. And so oftentimes where they cause infection associated with the skin, you will see pus associated with that. They're commonly associated with nosocomial infections, and these are institutionally acquired. So this has been a big problem where people come into a hospital without Staphylococcus infection and leave the hospital with a Staphylococcus infection. That's not okay. So many hospitals now are actually swabbing, they're doing nasal swabs with patients as they come in, checking for methicillin-resistant Staph aureus. They don't want those in there. That's not the kind that we work with in the laboratory either. So one of the things we learned about these guys is that they do produce a variety of enzymes and also toxins. They have various factors, so we talked about these. Coagulase that coagulates blood plasma. It was used in our diagnostic testing, but it also kind of allows Staphylococcus to wall itself off underneath. It gets in under the skin, and then phagocytes can't get to it. They produce kinase enzymes. Remember, those break down fibrin, allow them to be more invasive. They produce leukocidins that kill white blood cells, and two different types of hemolysin, alpha and beta hemolysin, that cause the lysis or kill red blood cells. Now, here are some of the infections that Staphylococcus aureus can be associated with when we're looking at the skin. One of the things that you would notice if you're looking at the lecture syllabus that has this kind of summary of organisms that cause disease, you'll see Staphylococcus aureus here with infections of the skin, but they also are associated with problems associated with the GI tract. And so I'm just going to throw all of that into the same category, I think. Now, is that what the notes do? Well, maybe. We'll see. So impetigo is a type of rather superficial skin infection, usually affects small children, but it can involve Staphylococcus, it can also involve Streptococcus. Oftentimes there will be a lot of like lesions on the surface of the skin, and if it's Staphylococcus aureus, there may be a kind of a crusty yellow formation from seeping that occurs there. That can often be secondarily infected with Streptococcus and cause more problems. Furuncles occur when Staphylococcus gets down into hair follicles, or they get down into sebaceous glands. Again, they are pyogenic, so there's pus associated with it. That's dead bacteria and phagocytic white blood cells, and you see this collection of pus. It's just below the surface of the skin. Wait, what is that? It's your birthday, haha. Gotta be your birthday.
Julie, you're 21. Julie, you can drug up illegally now.
Well, now that is scary.
I know.
2 days before final. You know, watch that. Bad timing.
Oh yeah, tell me about
We're
it.
talking about
I mean, I remember it was 2 years ago.
Don't be tempting her now.
Like, the drinking part.
Oh, God. Okay, so if Staphylococcus gets down underneath the skin, where the skin is relatively tough, oftentimes on the back of the neck or on the back, they can form structures called carbuncles. this is where you start seeing them produce the coagulates. They're kind of rolling themselves off, and yet they can spread around under the skin. You just have a lot of dead cells and dead phagocytes and a lot of pus. These abscesses spread around. Sometimes there's a collection of pus and blood. Pretty nasty, and you'll have these big patches, as you can see in some of these images. Now, Staphylococcus aureus can also cause what's called acute bacterial endocarditis. Endocarditis is inflammation of the endocardium, the lining of the heart. This can be very damaging because you don't want damage to the heart lining. That can damage the heart valves, and then they leak, and you have more difficulty with your circulatory system. From there, they can also get into the bloodstream and cause septicemia. And they are the primary cause of toxic shock syndrome. So this is an abrupt onset of high fever, vomiting, diarrhea, muscle pain, oftentimes accompanied by a scarletiniform rash, often drop in blood pressure, sometimes cardiac and renal failure, not favor. And this can be deadly in a relatively short period of time. I think that this was one of the things that first made the news in association with tampons, that were a certain type of tampon that allowed Staphylococcus aureus to persist. And apparently people were not very hygienic about how they were using those things and not changing them regularly. And toxic shock syndrome killed people. Now, Staphylococcus can also affect the gastrointestinal system. It's not causing infection there, it's causing intoxication. So they do produce some toxins. It's called an enterotoxin. If you recall, I said enterotoxin means it acts on the GI tract, but this is actually a neurotoxin. So it acts on the brain. It acts specifically on the medulla, which has the vomiting reflex associated with it, and it causes vomiting, often accompanied by diarrhea. This is pretty rapid action, so if you eat something like a tuna fish sandwich that's been sitting out in the warmth and the Staphylococcus is growing and producing its toxin, about 2 to 8 hours later, you're vomiting and you have diarrhea, and even if you empty your gut, the vomiting continues and you have dry heaves. It's a nasty situation because the toxin is acting on your brain and it's triggering that vomiting reflex. Yeah, not nice. And of course, Staphylococcus can also cause bacteremia, just bacteria in the bloodstream, and if your immune system can't control it, it can cause septicemia, which means the bacteria are reproducing in the bloodstream, reproducing faster than the body can get rid of them, and they're beginning to cause disease symptoms, putrefaction, if you will. Septicemia is potentially deadly. Okay, now we're moving on to streptococcal infections. When we're looking at skin infections, these often involve Streptococcus pyogenes. Again, they are gram-positive, but remember, strepto means cells in chains, whereas staphylo means cells in grape-like clusters. We did not work with Streptococcus pyogenes until physiological unknown 1. A few people got to work with strep pyogenes. They are fastidious, surprisingly difficult to grow in the laboratory, considering how problematic they are in the real world. They are also pyogenic, so they cause the formation of pus, and they produce hemolysis. The Streptococcus pyogenes is sometimes referred to as group A beta hemolytic stress. The beta hemolysis is what they do on blood plates. The group A is a Lancefield group based on serological typing. So if you're in a clinical setting and you hear people talking about group A strep, that's Streptococcus pyogenes, group A beta hemolytic. Not nice. These, as I said, can accompany Staphylococcus aureus in causing impetigo. And here you see on a youngster's face, nasty situation. Oftentimes this is from not washing regularly. And according to what people have reported at microbiology conferences, the washing doesn't have to be with antibacterial soap, it just has to be with plain soap and water. That's the best way to control it, plain soap and water, for controlling both the strep and the Staphylococcus. Streptococcus can also cause erysipelas. This used to be called St. Anthony's fire. It's an acute infection with rapid spreading, oftentimes from a site where Streptococcus is introduced, and then it can spread from there across the surface of the skin. Extremely painful. They can also cause scarlet fever. Scarlet fever is a secondary reaction, typically because you have Streptococcus pyogenes in the throat. Scarlet fever occurred prior to the ability of people to control Streptococcus infection with penicillin. They would have strep throat, and the strep toxins would get into the bloodstream and then that would cause this rash on the surface of the skin, scarlet fever. Scarlatina is similar, but it's a milder rash. And scarlet fever sometimes kills people. Even though the Streptococcus was not particularly invasive, the toxin it produced was causing a lot of damage. Remember, Streptococcus produces not only leukocytes, but also hemolysin that kill red blood cells. So for our matching situation, now Streptococcus will be a potential match. And Streptococcus pyogenes I will match either with strep throat or scarlet fever or rheumatic fever, because it causes all of those things. Not sure which one it will be matched with, and actually at this point the final's at the printer, but I don't remember which one's on there. Pretty sure Streptococcus pyogenes is on there. As I said, so Streptococcus pyogenes gets into the pharynx. They're not particularly invasive, but they do produce these toxins. Hemolysins, there's two types, streptolysin O and streptolysin S. They also produce streptokinase that breaks down fibrin, and they produce leukocytes that kill white blood cells. Complications of strep throat include scarlet fever, this rash on the surface of the skin, rheumatic fever, which can cause severe damage to heart valves and also damage to joints and sometimes damage to other parts of the body. And acute glomerular nephritis, which is damage to the kidneys.
If somebody had like strep throat and you encounter them, could you get like one of these other diseases?
You have to have strep throat. So you have to have the Streptococcus in your throat.
Right.
And then the Streptococcus is producing toxin that gets into your system. Basically, scarlet fever, rheumatic fever, those are hypersensitivity reactions to the toxin.
Oh.
Now, would you possibly have a strep infection and not know it? I suppose it's possible, but usually it's pretty painful. Typically, if people have strep throat, they know there's something wrong. Speaking from experience, my experience with strep throat was...
I had it like 2 weeks ago.
it's not nice. That's one of those things where now physicians are kind of going, yeah, maybe we should just kind of let this ride and see if your body controls it by itself, which is a little spooky knowing that these hypersensitivity reactions can occur. Yeah.
Usually the antibiotics they give you, they just work like that.
Sure, but what's happening now is people are beginning to say, should we be giving antibiotics to everybody that comes into the clinical setting? And the answer is no. We're overusing them. So the biggest problem is, you know, you'd like to use a narrow spectrum antibiotic. You'd also only like to apply antibiotics when you know you're dealing with streptococcus, as opposed to virus, which you can't treat with antibiotics. So they're being more cautious, that's all. Now, I brought this little guy out because this is our model. This is the necrotizing fasciitis strep. You see he's got a knife and a fork. This is the flesh-eating strep. So it's Streptococcus pyogenes, but it's a specific strain of Streptococcus pyogenes, strain F, that is called the flesh-eating strep. And these guys, again, they produce these various virulent factors, but they can get into the tissue and very rapidly spread. I had a student one semester that had gone someplace on a beach locally, well, locally as in out of the ocean, stepped on a piece of glass, got home, went to work. Fortunately, where he was working was in one of the local hospitals, and started complaining about the fact that his foot hurt really badly. One of the physicians on duty said, let's take a look at that. They said, oh my word, this was Streptococcus pyogenes strain. And he was right on the edge of getting a severe necrotizing fasciitis going, so they got him into treatment right away and dealt with it. Not nice. Okay, moving on. The next organism type that is a good match is Bacillus anthracis. This is a match with anthrax. Sometimes called hoof and mouth disease, but there's another viral infection that's called foot and mouth disease. So, or excuse me, yeah, there's foot and mouth and then there's hoof and mouth, and they get mixed up, so I don't call it that. We'll match Bacillus anthracis with anthrax. This is mostly a disease of horses, sheep, cattle, so technically it's a zoonosis. It's not something that normally infects humans, but it can. Oftentimes it affects humans that are handling animal products, wool or hides. Sometimes it's referred to as wool sorter's disease. These images that you see, this is cutaneous anthrax, but the Bacillus anthracis can also cause pulmonary anthrax, And that's what people were so worried about when, what was it, members of Congress that received the white powder in envelopes, and then Homeland Security got all excited, and a lot of people went into training to find out if they could identify anthrax spores. I don't know if they could or not, but it was interesting anyway. So, the next organism that again is not a match, this is a fill in the blank, Pseudomonas aeruginosa. These are gram-negative, sometimes referred to as the quintessential opportunists because they are not normally pathogens. They live in water, they live in association with soil, probably on plant material as well. They're all over the place, so ubiquitous means you find them everywhere. And the biggest problem with them is they are resistant to so many different types of antibiotics, probably because they're Pseudomonas. And if you remember from the early part of the semester, what can Pseudomonas do that was unique? They can use a very wide range of organic compounds as carbon sources, which means they break down all kinds of things. If you're trying to treat them and they can break down the drugs, they're not going to work. So this is very problematic. They produce an exotoxin. This is a protein that inhibits protein synthesis. This is very problematic because Pseudomonas often get into burn wounds, and then they prevent healing because the host, the human that's infected, can't produce the proteins needed to heal. They also produce this pigment. I tried to make the piocyanin a different color, but it's not right for the Pseudomonas color, really. It's more of a blue-green than green-green, but you'll often see this in association with Pseudomonas infection. So here you see them on a plate, the piocyanin pigment, and then you see some images of wounds where you can see that green coloration. That's indicative of Pseudomonas aeruginosa. There's also supposed to be a characteristic odor, but people can't agree on what they smell like. To me, they smell like grape bubblegum, and other people say, no, they smell like tortilla chips. Really? Grape bubblegum versus tortilla chips. I don't get the connection, but anyway. We do work with this organism on our physiological unknown set, so when you grow them on Mueller-Hinton agar, they turn it green. Put them on TSA, they'll turn that green as well. So they're problematic in association with burn wounds, but they're also very problematic in children with cystic fibrosis because they get into the lungs, they cause pneumonia, and they're really difficult to get rid of, again, because they're so resistant to antibiotics. They can cause ear infections, they can cause meningitis. You can see some pus coming out of that ear, but I'm not sure that's Pseudomonas. They also damage mitochondria, which is kind of interesting. Probably has to do with the fact that mitochondria were originally proteobacteria themselves, Pseudomonas or gamma proteobacteria, and a lot of times bacteria produce chemicals that kill other bacteria. It's a competition thing. The next match is Clostridium tetani. This would match with tetanus. So these are gram-positive endospore-forming anaerobic bacteria. When we did our pasteurization of soil, we did not expect to grow tetanus or Clostridium organisms because we grew our organisms in association with air. Tetanus organisms, all Clostridium for that matter, are pretty much anaerobic. So these are really common in soil because they're associated with the gastrointestinal tracts of animals. And I read an article that said they are, well, wasn't the word Bacillus, sorry. Bacillus anthracis lives inside earthworms. So that's another possibility. There could be other organisms in the soil that maintain some of these organisms. These things cause infection, often in association with puncture wounds, or when soil gets into tissue due to damage that might be association with battlefield wounds. The next one that we did not have is an outbreak on the refrigerator, but you can expect to see on the matching section in the final is Clostridium perfringens. This is the most common cause of gas gangrene. Gas gangrene is also called myonecrosis, but I think the more common term for it is gas gangrene. What's happening here is the Clostridium perfringens get established, and then they produce a lot of gas as they're metabolizing, and the gas disrupts the tissue and cuts off the circulation. Well, that makes more of an anaerobic environment, and then they can spread. This becomes very problematic, and it used to be the only way to control gas gangrene was amputation. And so people would have appendages removed, simply cut off, because they couldn't stop the growth of the Clostridium. They couldn't restore the blood supply. Now they have hyperbolic chambers where they can put people in. As I said, that's like, wait, are they hyperbolic or hyperbaric? Anyway, hyperbaric, because what they're doing is increasing the oxygen content, putting them under high oxygen pressure, and then they can kill these guys. They're extremely sensitive to oxygen. Pretty nasty images. So that is a match, gas gangrene with Clostridium perfringens. Now we're going to infections of the gastrointestinal tract. Some of these, we start off with infections in the mouth, and the easiest part about this is you all have mouths, and so you can kind of relate to what I'm going to be talking about because you've probably experienced at least some of these things. Hopefully not all of them. So, conditions that exist in the mouth. First of all, plaque. I can pretty much guarantee that everybody has had some experience with plaque. This is just the sticky white layer that forms on the surface of the teeth, particularly if you have a high carbohydrate diet for whatever reason. If you use your dental floss, you can scrape that stuff off, and it's this white, sticky, goo, weird stuff, but it comes back. It just keeps coming back. It's because the bacteria are living on the surface. The bacteria produce capsules. The capsules, glycocalyx, that's what makes the sticky mass. And then there's salivary proteins mixed in with it. The big problem with plaque is it does tend to create an anaerobic environment, which can then lead to fermentative type organisms producing acids that can cause more damage. Plaque is just kind of a nuisance. If calcium salts get deposited in plaque, then it's called calculus. You begin forming calculus particularly on the underneath side, or on the back side of your lower incisors, because you have salivary glands under the tongue. There's a lot of calcium there, and so very often the dental hygienists, they use their little tools and chip that calcium, that calculus off of there. Major contributors to the formation of calculus are these gram variable actinomycetes. So they're some of the organisms that are now, they're in the phylum Actinomyces, and there's quite a number of these different guys. Then we have dental caries. People would probably more commonly refer to these as cavities. These are holes in the enamel, and they're due to the production of acids by bacteria that are living under these anaerobic conditions in the plaque or in the calculus or between the teeth. And then you can have periodontal disease. So these are diseases. Periodontal disease is inflammation or destruction of the soft tissues supporting the teeth. And there are categories of periodontal disease. So they can be just inflammation of the gingiva, the gums, where they're just a little bit red and swollen, a little bit painful, maybe they bleed a little bit. They're not supposed to look like that. If you have periodontitis, that's destruction of the deeper tissue. And periodontitis can cause your teeth to get loose and actually just let go and fall out, and oftentimes without a lot of pain associated. And then you have acute necrotizing ulcerative gingivitis, which is shown in the picture here, where there's a lot of damage being done to the teeth and to the gums, and it can lead to tooth loss, primarily due to stress. So we hope none of you are that stressed. Yeah, so it's getting pretty bad in here, but hopefully not that bad. Moving on, we have another match. This one's kind of tough because on the matching section I match genus, typically with specific epithet. But for this one, it's going to be genus. Then we're going to skip a couple of names in between, and I'm going to give you the variety name or the serovar name, which is typhi. So we're going to call Salmonella enterica serovar typhi just Salmonella typhi. This is the organism that causes typhoid fever. It used to be called enteric fever, but remember I was talking about typhoid Mary, who was infected with the Salmonella but didn't believe she was because she didn't have any symptoms? That was Salmonella typhi. Notice the T on typhi is capitalized. That's not a specific epithet. That's a serovar, serological variety. So they are Salmonella enterica, subspecies enterica, serovar typhi. Like, oh my word. Anyway, these are actually invasive organisms. So they get into the gastrointestinal tract, usually associated with contaminated food or water, and then they can actually go into the cells of the intestinal mucosa. They are consumed by phagocytes, but they are not digested by phagocytes, so then they get carried around, and the phagocytes kind of spread them around. They multiply inside those, and then they can infect various parts of the body. There was a person, again, at a microbiology conference talking about how he was infected with Salmonella typhi, and it had to do with eating fresh watermelon in India. It was assumed that it was a fresh watermelon, it hadn't been cut yet, it shouldn't be contaminated. But what had happened was farmers were injecting melons with water to increase their weight. This is more common than you think, where you buy melons in the market and you find out these melons are really heavy. It's because people are injecting water into them. And if the water's dirty, which it often is, not good. So he got Salmonella typhi from eating fresh watermelon that had been injected with water. Not nice. This is potentially deadly. Prior to the use of antibiotics, this Salmonella typhi could cause death in 10 to 15% of people that were infected. So it's a nasty type of infection. Then we have Salmonella enterica cerebar typhimurium. This one we would just call Salmonella typhimurium. This is the most common cause of Salmonella infection if you eat contaminated eggs or contaminated food that's made with eggs, mayonnaise or peanut butter or something like that. This one also causes vomiting and profuse diarrhea. It takes a little bit longer than Staphylococcus poisoning, so it's 8 to 48 hours after ingestion. Oftentimes you experience nausea and a headache, and then you start with the vomiting and diarrhea, and you're very sick, sometimes for a couple of weeks. I had one student that was infected with Salmonella typhimurium from this laboratory because a lab partner spilled it on her lab notebook and didn't say anything. And she was out of school for about 2 weeks. It was not nice. Yeah. So we no longer work with Salmonella typhimurium. Now we work with Salmonella choleratus. It's probably just about as bad. And that's why you're not supposed to eat or drink in the microlab. Yeah, don't pipe that by mouth either, no.
I love that sign.
Now another potential match is Shigella, specifically Shigella dysenteriae. This would match with dysentery. They're not the only organisms that cause dysentery. They're not the only bacteria that cause dysentery, but they definitely do, and they have a very low infectious dose. It only takes a couple of hundred cells to infect somebody with Shigella. We used to buy these boxes of freeze-dried discs that we'd use for physiological unknown 1, where you have all these gram-negative enteric type organisms, and we never used the Shigella. They always came with sets of Shigella in there, and we'd look at them and go, no, I don't think so. Not in an introductory microclass, but it would certainly infect somebody. We might infect multiple somebodies, so we never did. Apparently, it's really hard to get rid of this guy, too. Notice these are transmitted by food, fingers, feces, and flies. That sounds good, huh? Just, you know, unsanitary food handling, and it doesn't take much. And then we come to Escherichia coli. Once again, this will not be a match. And it would be nice if you could spell it. Escherichia, named after Dr. Escherich. Anyway, so these guys, we don't think of them in this laboratory as being terribly pathogenic. We play with them in terms of taking out plasmids and putting plasmids in. And the host strains, JM83 and DH5 alpha, are really not highly virulent strains of Escherichia coli. But different people can have fairly virulent strains living as part of their normal microbiota. So you have to be a little bit careful about students isolating their own Escherichia coli and then letting somebody else work with them. So there are several of these mentioned in the lecture syllabus, and they have these acronym type names, the ETEC, that's the enterotoxigenic E. coli. They produce protein exotoxins. Again, I mentioned this when talking about enterotoxins, but I specifically talked about the cholera toxin that causes a change in your electrolyte balance so that you excrete electrolytes into the lumen of the large intestine and water follows and it causes severe diarrhea. These have similar effect. Then there's enteropathogenic E. coli. These apparently bind to host cells. They produce a protein called intimin, and it causes host cells to lose their microvilli. Microvilli are what increase the surface of the intestinal mucosa, so it decreases their ability to take in nutrients. Then there's the enterohemorrhagic E. coli. These occur in sporadic outbreaks. Probably the most recognizable of these is the E. coli, again, serological variety, O157H7. These can cause, or they produce a Shigella-like toxin, so they can cause dysentery, but they're more problematic because they can cause damage to red blood cells and hemolytic uremic syndrome. So hemolytic uremic syndrome, I think it was first recognized in association with ground beef in a Jack in the Box restaurant. But when beef is ground, it's really difficult to control Escherichia coli. They live in the gut of animals. You can imagine there's occasional infection associated with surgical procedures in hospitals. Compare the aseptic technique under those circumstances to the lack of aseptic technique in a slaughterhouse, where the animals are, their skins are pulled off, they're being hung and dragged around. Anyway, it's pretty difficult to make sure that Escherichia coli isn't associated with meat. And then ground beef, they're now taking beef from multiple different animals and grinding it up and mixing it all together. You should never eat ground beef raw. It's just way too dangerous to do that. Anyway, E. coli O157H7 can cause hemolytic uremic syndrome. It causes changes in fibrin so that the fibrin is crossing the blood vessels, and as the red blood cells go by, they get sliced. And so it causes damage to red blood cells, which then causes damage to the kidneys, and it is sometimes fatal. Then there's enteroinvasive E. coli, again causing dysentery-like symptoms. Really interesting features. When we first started using the nucleotide sequencing to identify organisms, the nucleotide sequence for Shigella dysenteriae and Escherichia coli were so similar that we couldn't tell them apart. It took a while for the sequencing to get more accurate, get longer, better reads on the sequencing. But I thought it was interesting that they're so similar on their 16S ribosomal RNA, because when you do enzymatic testing on them, they're very, very different. The Shigellas are not lactose positive, E. coli are. In fact, the Shigella are negative for most of the carbohydrates. But apparently, their 16S rRNAs are very, very similar. And of course, if you have Escherichia coli that gets into the bloodstream, these can cause septicemia, but they're also gram-negative. They have lipopolysaccharide in their gram-negative walls. And if you recall way back when talking about composition of gram-negative walls, I said a feature of lipopolysaccharide is it's highly toxic to mammalian cells. So if you have E. coli in the bloodstream, you treat the individual with antibiotic and kill the E. coli, that can make the situation worse. Because the lipopolysaccharide is an endotoxin, it's released when the cells are killed, and then the endotoxin causes all kinds of problems. It causes fever, but it also causes abnormal clotting mechanisms that can result in circulatory shock, and it kills people. So it's again abbreviated LPS, lipopolysaccharide is nasty stuff. Another feature of Escherichia coli is that they're the most common cause of bladder infection, which is also called cystitis, and also infection of the kidney. This is more common in females than males, primarily because the opening to the urethra is a very short distance from the anal opening. E. coli lives in the gut. It's pretty easy to get Escherichia coli at the anal opening, and if you wipe in the wrong direction, you put them right into the urethra. From there, they go up into the bladder, and then from there they can go up the ureter, get into the kidneys. So they can cause pyelonephritis, which is inflammation of the kidney. Then they can cause inflammation of the pelvic cavity. Escherichia coli can also cause meningitis, usually in association with neonates. So this is one of the reasons that they're not a good match. They cause all kinds of problems, and because you should all know the name Escherichia coli. You should be able to write that into a blank. It's not going to be a match. Okay, the next one that is a good match is Vibrio cholerae. These are the causative agents of cholera. Again, they're gram-negative. Vibrio means they're comma-shaped organisms, so they're kind of short, bent rods. They produce the cholera toxin. It's called collagen or CTX. I don't know why the CTX, but anyway. Again, what it does is causes the large intestine to, instead of absorb water, dumps electrolytes, and then water follows into the large intestine, and the person basically loses so much water with a very watery diarrhea that they die from dehydration. They can literally dehydrate themselves to death. Mortality rate of cholera is between 25 and 50%. And it's endemic in certain parts of the world, particularly in Southeast Asia, India. Any of you watch Vice? News program Vice? They had a program where they were showing people in India, fairly good-sized villages, where the water supply had dried up because of climate change. And so these people were desperate for water. And the water came in these giant trucks. And then the people hopped up onto the trucks, opened the top, and immediately started putting these hoses in to siphon the water out. But the hoses had been laying on the ground, and it was all muddy, and it was just like, oh my goodness. Cholera is endemic, and you just contaminated your entire water supply. It's terrible. Anyway, that's a match. Vibrio cholerae with cholera. Another good match is Helicobacter pylori. This matches with gastric ulcers. We used to think ulcers were due to stress or a poor diet, acidic diet. People would avoid eating certain things and they tried not to be stressed. Well, it turns out it was caused by a bacteria that was causing infection, Helicobacter pylori. Some enterprising microbiologists proved this by infecting themselves with Helicobacter pylori. Anyway, these things live in the stomach, so they're very adapted to a very low pH. The pH in the stomach is often 1 to 2. And oftentimes they don't cause any damage at all, but sometimes they cause gastric ulcers. Unfortunately, what they're finding is that because of the use of antibiotics, Helicobacter pylori is kind of dying out in the human population, and they think this is very problematic because although they sometimes cause ulcers, removing them often can lead to esophageal cancer, which is not a good situation. So now we're going to infections of the upper respiratory tract, and again we see Streptococcus pyogenes. If you have strep throat, that's where they're in the upper respiratory tract. They're in the pharynx. They're not terribly invasive. They just hang out in the pharynx and produce their toxins that cause scarlet fever, rheumatic fever, etc. So we already talked about strep enough. We don't need to talk about that more. That is a potential match, Streptococcus pyogenes, with strep throat or scarlet fever or rheumatic fever. I don't remember which. The next good match is Corynebacterium diphtheriae, is a match with diphtheria. So this is an upper respiratory tract infection, not something that we have a lot of in this country because most people are immunized against it. The Tdap vaccine, diphtheria, you're given a toxoid, detoxified microbial toxin, because again, it's the toxin that causes the disease symptoms. These guys live in the pharynx, they produce toxins that go into the bloodstream, and then the toxins cause the damage. Symptoms of diphtheria typically include fever, chills, fatigue, cyanosis, sore throat, cough, headache, difficulty swallowing. They're living in the throat and they do cause a certain amount of inflammation there. But they can eventually cause damage. They get into the bloodstream, cause swollen lymph nodes, and necrosis of various tissues, which again is potentially deadly. This is a type of infection that, again, you don't see this in this country. Why do we immunize? We immunize if something is likely to spread rapidly, and if the risk of being infected far outweighs the risk of immunizing. The risk of getting diphtheria definitely outweighs. It kills you. Yeah.
Just real quick, is it going to be matching like the study guide, or is it
matching where Corynebacterium is in one column, diphtheriae is in another column, and the disease diphtheria is in a third column. Yes, they're split up because otherwise diphtheriae, it tells you what it causes. Like cholerae tells you what it causes. So I have to split the genus names from the species. Here in this throat, you can see the patch. The Corynebacterium, they're just living right here in the throat. But again, they're producing the toxins that then get into the bloodstream, and that's what causes the trouble. So yeah, it says, rarely experienced in this country because people are immunized, or should be, because we have a good toxoid. It's very effective. Don't not be immunized. Another good match, Bordetella pertussis. This is a match with whooping cough. This is another component of the Tdap. The P is pertussis. So this is actually a vaccine. These are gram-negative organisms, but they cause a very severe type of a cough. Whooping cough is associated with children taking in breath. Well, they cough, 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 and when they take the breath in, they take it in as a kind of whoop, and then cough, 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 cough. And they are coughing and breathing and wearing themselves out so badly that they're often then susceptible to secondary infection. Sometimes it's the secondary infection that really causes the big problem, but it's very damaging to their throats to have whooping cough. A next match, if we match pneumonia with anything, it will be a match with Streptococcus pneumoniae. This is the primary cause of bacterial pneumonia. We went through and talked about other things that can cause pneumonia, like Pseudomonas aeruginosa, Klebsiella pneumoniae, Mycoplasma, but Streptococcus pneumoniae would be the match, so watch out for that one. Notice then you can have a genus name that can match with more than one species. So we have Streptococcus pyogenes that causes strep throat, scarlet fever, rheumatic fever, Streptococcus pneumoniae that causes pneumonia. Anyway, pneumonia is inflammation of the lung, but it's also characterized by the lungs filling with water, and then people can't breathe. It's very painful to have pneumonia, and that fluid accumulation ultimately will cause them not to be able to get the oxygen they need, and it's potentially fatal. Pneumonia affects 450 million people per year. Presumably those are new infections of pneumonia. What's nice is that there's now a pretty good vaccine against Streptococcus pneumoniae, and elderly patients or elderly individuals are highly encouraged to be immunized against Streptococcus pneumoniae. This is just a list of some of the other bacteria that cause pneumonia: Haemophilus influenza, Klebsiella pneumoniae. Interesting feature of Klebsiella pneumoniae is it usually causes pneumonia in alcoholics and diabetics. Probably has something to do with elevated blood sugar levels. Mycoplasma pneumoniae, that's the walking pneumonia, and Pseudomonas aeruginosa, primarily in children with cystic fibrosis. This is asking, what else can Streptococcus pneumoniae cause? Anybody know? Meningitis. This is problematic. Apparently, they're starting to see Streptococcus pneumoniae causing meningitis. Okay, moving on. The next good match is Legionella pneumophila with Legionnaire's disease. This was a disease that was probably misdiagnosed as pneumonia for a very long period of time. It wasn't until a Legionnaire's convention in Philadelphia in 1976 that they actually identified the causative agent as being something different, Legionella pneumophila. These organisms live in water, and apparently that they're not, they're kind of accidentally human pathogens. They cause sporadic outbreaks, sporadic disease. But the symptoms are similar, so they get the high fever, the cough, and they get decreased respiratory function. They do cause pneumonia-like symptoms. These guys are sometimes associated with supermarket sprayers or the sprayers at the fairgrounds when you go, or at the hardware store in the summertime. They spray people coming in from the parking lot. They're in the water.
What?
Hopefully not if the water's treated. Okay. Next, we have most common cause for tuberculosis is Mycobacterium tuberculosis. So there are some other species of Mycobacterium that can cause tuberculosis, but this is what we'll match. Again, notice how the species names often tell you what the disease is. This is why they're in separate columns. So these are gram-positive. They're acid-fast. They're very slow-growing organisms. The Mycobacterium in general are pretty slow-growing, and these organisms normally live in association with soil or water, but they can get into the respiratory system. Just exposure to Mycobacterium tuberculosis doesn't necessarily mean that you have the disease, but if you're exposed to them, you are very often going to develop a T cell response to them, so your immune system, cell-mediated immune system, will respond. Typically, you get them by breathing in droplet nuclei, where they've been released by somebody. My understanding is it's not something that is an occasional occurrence. So typically, people that get tuberculosis are around somebody else that has tuberculosis for quite a long time. It takes a while to be infected. As soon as I say that, I think, yeah, but I heard a story about some hospital where a group were moving a patient on a gurney through a specific part of the hospital. And then everybody that was in that area at the time tested positive on a tuberculin time test. So they had all been exposed. They didn't get tuberculosis, but they'd all been exposed. Anyway, this thing tends to cause chronic disease, very long term. It can also cause latent disease because they get into macrophages, phagocytic white blood cells. They don't die. They're not digested. They get carried around. Then they could cause problems in the lung for a while, and then those can get walled off and they're kind of separated and not causing any problem. And then they can reactivate years later. This is talking about the tuberculin time test, which is used in this country to test people for tuberculosis. Certain people are tested on a regular basis. So if you're working around other people a lot, teachers are tested, people working in the clinical setting are tested. In the United States, we don't use the tuberculosis vaccine. There is a vaccine against Mycobacterium tuberculosis. We don't use it here because we want to be able to test people with the tuberculin time test, which involves putting a little bit of material under the skin, and then if you get this big swollen indication of a lesion, then you've been exposed to Mycobacterium tuberculosis. And then you're never supposed to have this test done again, because if you have a positive test, it's a cell-mediated immune response. And remember, cell-mediated immune response involves killer T cells, which can cause severe tissue damage. And so you can have another time test and have a big skin lesion develop. In this country, apparently, if you get a positive tuberculin time test, then you're only supposed to have chest x-rays thereafter to test for tuberculosis, which is kind of sad because there's another method. I can't tell you what it is. I've been told by the best of authority. There's another method that works better. But why don't they use it? Because I can't remember what it was. I can't remember what it was. No, so who told me this? It was a PA, was my son, who's a PA, and he said they don't use it because it's something that they haven't developed the standard for it, or there's money involved. I'm not sure what. It's like, what? But anyway, you never know. So positive response, again, is cell-mediated immunity involving cytotoxic T cells. So now we're moving to infections and diseases of the urinary tract. We've already talked about Escherichia coli causing bladder infection, kidney infection. They can cause pyelonephritis, like glomerulonephritis. So now we're moving to gonorrhea. This is another match. Neisseria gonorrhoeae matches with gonorrhea. These are fastidious gram-negatives. Yeah.
What was that last slide? It was infectious diseases of urinary?
Yeah, urinary tract. Urogenital, which in males are connected and in females are not. But anyway, so Neisseria gonorrhoeae is a match. Again, they're fastidious. These guys grow on chocolate agar, which we never have in this laboratory, so we can't grow Neisseria gonorrhoeae. They're one of the most common sexually transmitted diseases. The other one is chlamydia. I can say right now, chlamydia, it's chlamydia trachomatia, and you won't see that on a match with a disease because the disease is called chlamydia. Really? Well, anyway, so these guys apparently, in order to infect, have to bind to the host cells using pili, and the pili, being able to produce pili, is due to lysogenic conversion. Interesting, in these images, what you see is the end of a penis that has gonorrhea, and then you see two images of eye infection. And that's the other thing that Neisseria gonorrhoeae can cause, is infection of the eye, which can be very damaging and lead to blindness. In males, this causes a painful sensation upon urination, like that poster, really painful. In females, unfortunately, the symptoms can go unnoticed. And this is a real problem, not only with gonorrhea, but with other sexually transmitted diseases, because the female genitalia, the area where you would see infection, they're internal, so you don't see infection. There is no pain. The urinary system is separate, so there's no painful urination associated. And women can be infected and not know it. So asymptomatic, you can be infected, you don't know what's going on. This can lead to accidental infection of a fetus during the birth process. As the infant is passing through the birth canal, they can be infected, and Neisseria gonorrhoeae can cause blindness. But this organism can also cause damage within the female reproductive system. So they can get up into the fallopian tubes, they can cause lesions in the fallopian tube that can lead to sterility. Those lesions also make women much more susceptible to infection with HIV, which is very problematic. And because the female fallopian tubes are actually open to the pelvic cavity, bacteria that get in there can go right into the body cavity, and then you get what's called pelvic inflammatory disease. So much more dangerous to women than to men, simply because you don't know they're there, and then they can persist in the body for a long time and cause lots of damage. Another organism that is similar in terms of being asymptomatic in women is syphilis. So I brought my spirochete in. This is the syphilis spirochete, and it's so cute here. But anyway, that's Treponema pallidum. These are apparently pathogens only of humans, and they've been around for a very, very, very long time infecting people. Typically, infection is via direct contact, sexual contact. They can go right through dry skin. Sometimes they get in a break in the epidermis. They might get into skin not associated with the genitalia. There are stages of syphilis, primary, secondary, tertiary stages, and the first two are treatable with antibiotics. The third is really tough to treat these guys because they get into the cerebrospinal fluid and into the brain, and it's hard to get drugs there. So the primary stage, typically you have multiple local multiplication of the spirochetes where they've gotten in. This produces a hard canker. On males, the canker is visible. I have some stiff pictures. Notice that two of those pictures are penis and one's a tongue. That hard canker could be in the mouth. But so on a male, they're going to be visible. They're external. Those same lesions on a female are going to be up inside. They're in the vagina. They're not someplace where you'd notice them. Apparently, they're not particularly painful. So they're painless, they're visible or not. Secondary stage, the spirochetes are pretty much throughout the body. And then any lesion, any break in the skin can potentially release these things, and then they are infectious agents. And here you see lesions on the finger. And there's a skin rash associated with this. They get into the tertiary stage, presumably your immune system hasn't controlled these guys, so now what they've done is spread into the central nervous system. They can also cause cardiovascular damage, they can cause ulcerations on various tissues, and eventually cause death. They also cause a severe neurological damage, resulting in insanity, basically. They can cross the placenta. This is another problem with sexually transmitted diseases. These bacteria can cause congenital disease. They can cross the placenta and infect an unborn fetus. So gonorrhea can do this, and syphilis can do this. This is showing you chlamydia trachomatis also causes sexually transmitted disease and eye infection. They will not show up on the matching section just because I don't want to match chlamydia with chlamydia. These are sometimes more common. There are more common sexually transmitted disease than gonorrhea.
Syphilis be on the matching?
Yes. So syphilis, Treponema pallidum, match with syphilis. Neisseria gonorrhoeae, match with gonorrhea. And then this is just what I was saying before. Infection in females are more dangerous than they are for males. Expected to see this as a type of question on the final exam. Why are they important? Because for females, they're asymptomatic. Females don't know they're infected. Although sometimes females find out that they're infected with Neisseria gonorrhoeae because they get an eye infection, which can happen, then that's noticeable. But if they're just associated with the genitalia, they're not going to be showing any symptoms. In females, again, they can move up the fallopian tube, they can cause pelvic inflammatory disease, they can cause sterility, they can cause lesions that make people more susceptible to HIV infection, which is deadly. We're going to be watching a film about HIV this evening, about HIV epidemiology. And again, they can cross the placenta and cause infection in a developing fetus. So they can cause blindness, deafness, anatomical abnormalities, stillbirth in the worst of cases. Okay, so that brings us to infections of the nervous system. This one again is a match. We will match meningitis with Neisseria meningitidis. They're not the only cause, but they're one of the most common causes of meningitis. So Neisseria meningitidis is a match. These are sometimes called meningococci. Typically they form two little cells connected together, diplococci. If you're infected with Neisseria meningitidis, symptoms are typically severe headache accompanied by a stiff neck. Sometimes people experience vomiting, but oftentimes it's just this extreme headache and stiff neck. The symptoms occur very, very quickly, and typical pain medication doesn't make it go away. Unfortunately, this is potentially deadly in a very short period of time, especially in youngsters. This is telling you that meningitis can be caused by other things, as I mentioned, Streptococcus pneumoniae, Haemophilus influenzae. So now there's a Haemophilus influenzae vaccine to prevent meningitis from Haemophilus. By the way, we don't match Haemophilus influenzae with anything because they don't cause influenza. And everything they do cause doesn't relate to their name. Anyway, Escherichia coli can cause meningitis. Listeria monocytogenes, we never talk about. Pseudomonas aeruginosa. But again, we will match with Neisseria meningitis. The next good match is leprosy. Leprosy is a match with Mycobacterium leprae. In this country, leprosy is referred to as Hansen's disease. I don't know if it's called leprosy throughout the world. And Mycobacterium leprae is not the only causative agent, but it's the most common one. This one tends to cause infection in cooler regions of the body, the extremities. And part of what happens is people accidentally injure themselves, and then the mycobacterium get in. Again, these guys live in the soil and water. They're pretty common. When they get into a surface wound, one of the symptoms, one of the things they do is they cause damage to the peripheral neurons, and you lose your sensitivity to pain. And then you can have more damage done, and you don't know that you're having damage done because you don't feel it. They get into the eyes. Again, there was a person reporting or talking about being exposed to Mycobacterium leprae and begin to suspect that they were probably infected, because what they were noticing that there was a lot of wind and dust in the air, and other people were complaining about the dust getting in their eyes, and this person didn't feel anything. Not a good sign. The infection with Mycobacterium had deadened their peripheral neurons. So there's two forms of leprosy. Tuberculoid leprosy involves localized infection. It'll induce a cell-mediated immune response. And if your immune system is functioning properly, that should prevent the spread. Your T cells will kill them off. If that doesn't happen, then you can develop lepromatous leprosy when the immune response is inadequate, and then these things spread. They're going to cause more damage to tissue, and again, because people don't feel the pain, oftentimes they'll cause more damage accidentally. A lot of times it has to do with people, you see damage to their hands, it has to do with people smoking, and they don't feel the cigarette burning down and burning their skin, and then they get dirt in the wounds and they get worse infection. They tend to lose extremities. Then we come to infections of the circulatory system. Quite a number of these are kind of new ones, and I'm not sure that we had all of these on our outbreaks list on the refrigerator. We talked about Staphylococcus and Streptococcus already, that these guys can cause bacteremia, they can cause septicemia, they can cause acute bacterial endocarditis, also subacute bacterial endocarditis. But we want to look at some that are new ones that are matches. So Borrelia recurrentis. We had Borrelia burgdorferi, we had Lyme disease. I don't think we had relapsing fever as an outbreak. So this is a new one. Borrelia recurrentis. We'll think of something being recurrent, relapsing. It's something that the symptoms develop and then they go away, and then they come back and they go away, and they come back and they go away. So we have this repeated series of symptoms. This is technically a zoonotic type of disease, so it normally affects animals other than humans, but humans can get Borrelia recurrentis. Vectors are ticks. Primarily you'd get it by being bitten by a tick, and you'd have, after a period of 3 to 10 days, you'd have chills and fever, and then, as I said, that goes away, and then it comes back, and then it goes away, and then it comes back. If you had these kinds of symptoms where you kept having these repeated, kind of unexplained fevers, and you had been bitten by a tick, you might be thinking that you had Borrelia recurrentis infection. Then we have Borrelia burgdorferi. This is the primary cause of Lyme disease. There's been another Borrelia species identified recently that also causes Lyme disease. And a lot of people put an S. They want to call this Lyme's. It's not Limes as in named after somebody, it's Lyme as in named after a town in Connecticut. So there's no S on Lyme. Again, the vector here is a tick. It's the little bitty tick, the Ixodes ticks. We looked at Ixodes damani on our lab exam, and that's because that's the tick. We buy our ticks from Carolina Biological, so our tick came from Carolina. We have Ixodes ticks in California, they're Ixodes pacifica. They look very similar. This is a particularly nasty disease. Typically, if a person is bitten by a tick, they'd want to watch to see if they get this lesion that develops. You can see the red ring around it. If you saw that, you'd want to for sure take that tick live to a facility that will test them. And we're fortunate here because Placer County Department of Public Health tests them. You want to keep your tick alive, so just put it in a Ziploc bag with a piece of cotton with some moisture on it, and they'll stay alive in there, and then you take them up there. What they do is mash them, and they use a fluorescent antibody to test for Borrelia burgdorferi. For a long time, people said, no, we don't have Lyme disease in California. Yes, we do. We most definitely do. And if you're bitten by a tick and you think maybe that it might be a Lyme tick, you want to take antibiotics because you don't want to mess around with Borrelia burgdorferi. These guys are kind of like the spirochetes that cause syphilis in that they can get into the nervous system and cause some serious damage. Next match is Yersinia pestis. Yersinia pestis is a match with plague, bubonic plague, the Black Death. This was associated with rodents, well, because the rodents can be infected by Yersinia, and then the rodents are bitten by the fleas, and the fleas then get off the rodents and bite people. Plague is endemic to rodent populations throughout the world, but particularly here in California. So pay attention to plague warnings if you encounter those. Oftentimes in the Sierra Nevada, you'll see signs up where they tell you, they say plague warning, they say don't mess around with rodents in the area. You find a dead squirrel, leave it alone. There was an incident of a lady that was I tell you guys this story about the lady with the daycare center, and her cat brought a squirrel in. So she gathered up the kids and they did this little ceremony and buried the squirrel and had a little funeral for it. Next day the cat was sick. The next day the lady was sick. She went to the doctor. The doctor, I don't know whether he gave her antibiotics or what, but the next day she was dead. And it was determined that it was plague. And then they had to go and find all the children and find out if any of them had been infected. Fortunately, nobody was, but not nice. So this is the vector, the rat flea or rodent flea. Typically what happens is this, the Yersinia organisms plug up the mouth parts of the flea, so these guys become ravenously hungry and they just keep biting and biting. And then they're just spreading the Yersinia. By the way, Yersinia pestis, they were originally identified as Pasteurella pestis, and they were named for Louis Pasteur. And then at some point, it was determined those guys aren't really Pasteurella. Then they changed their name to Yersinia, and they're named after a Russian investigator by the name of Yersin. Another thing about plague, although it is normally transmitted by fleas, it can get into a pneumonic form where if you have a lot of people that are infected and they have very severe lung infection, they can infect one another with droplet nuclei, so it's highly contagious. This is showing some of the damage caused by plague. Gets into the lymphatic system, causes enlarged lymph nodes, which were called the buboes, associated with bubonic plague. But then you see necrosis in the tissue. So they can cause severe damage and death. Another match is Francisella tularensis. This is a match with tularemia. We did have tularemia as an outbreak, right? Yeah. And I told you guys this is named after Tulare County. This is where it was identified, Tulare County in California. This again is a zoonosis. It's normally a bacteria associated with rodents, and it is transmitted by biting flies or ticks, but apparently people can also get it by handling dead animals. So people that hunt rabbits, squirrels, whatnot, and then if they're skinning those animals, they can get Francisella tularensis infection. This causes pneumonia-like symptoms and oftentimes fatal septicemia without treatment. And for a while, this was considered to be a potential germ warfare agent, something that could be developed to infect large numbers of people very quickly. Another match, and we did have this one also, was Rocky Mountain Spotted Fever, is a match with Rickettsia rickettsii. So these are, again, transmitted by ticks. I believe the Dermacentor andersoni is the vector for Rocky Mountain Spotted Fever. Disease symptoms include a high fever and muscle pain, but there's a characteristic rash around the wrists and ankles. So if you have been in an area where there are ticks and been bitten on it by a tick, you start developing this rash, and you know it doesn't have to do with your socks being too tight. Could be Rocky Mountain Spotted Fever. This one I don't think we had on the refrigerator. Rickettsia prowazekii. These are the causative agent of epidemic typhus. Not typhoid, but typhus. This was a disease that killed more people during World War I than did gunshot wounds. The primary reason was the conditions that people were living in. They dug these trenches, and then they had people living in these trenches, and they were in those things for months. They had no sanitation, very poor hygiene. They got the lice associated with them, the body lice, Pediculus humanus corporis, the body lice, and then they started transmitting rickettsia between people and caused very severe damage. Again, symptoms are high fever, headache, typically a rash, but if these guys get throughout the system, get into the bloodstream, they can cause kidney damage, heart damage, neurological damage, and ultimately death. What's interesting about this is Pediculus humanus corporis, the body louse, we know transmits Rickettsia prowazekii, but supposedly head lice don't transmit anything. I don't know why. Could they, if there was something for them to transmit? I don't know. This is another one we did have. Scrub typhus is caused by an organism now identified as Orientia tsutsugamushi. If you look in older references, this was also a rickettsia. So it used to be called Rickettsia tsutsugamushi. Probably because of nucleotide sequencing, it was determined these guys are not really rickettsia, so they moved them into the genus Orientia. They're transmitted by vectors, but they're mites, not a mite that we looked at. Again, fever, headache, sometimes a skin rash, and fairly high mortality rate without treatment. Wow, that's the end.
Look at you.
Yeah. Woohoo! You caught up and got it done. Yay! Okay, so yeah, we don't have a quiz. The only thing we're doing tonight, here's my proposal, is that you will give me as much finished homework, quiz 12, whatever. I will try to grade it while we're watching a film, while you're watching a film. Hopefully, people can watch this film without making a lot of noise, because the film has conversations happening between people, and there's a lot of subtitles.